I'm David Nicholson. I'm the Managing Director of Tektology in the UK, Middle East and North America. In this Praktis series, we'll be talking public value, health service infrastructure and digitalisation, and some of the leadership challenges that come with all of that. Outside of Australia, Tektology is an international healthcare digital consulting business. I've spent, as you can tell from my accent, a lot of my career in Australia. I'm British as well. I'm based in the UK now. I've spent a considerable amount of time working in Australia, New Zealand, Britain, Canada, India. We have a very strong background in the public service, but we've worked in the private sector too. So for a lot of my career, I was a senior public servant in Australia, a deputy chief executive of large government departments, both in Victoria, so Melbourne, and Tasmania, Hobart. And we started the business, as all good businesses seem to have started, during COVID, when everyone had a chance, I think, to really rethink what they wanted to do with the world. We work in healthcare primarily. I've got a lot of experience in other sectors as well. We work at the interface of operations, digital and infrastructure, and what we try to do is use digital as a lever to help transform healthcare systems, improve outcomes for patients, and transfer knowledge between different parts of the world. I've done lots of redevelopments or new developments of buildings. I've worked on large-scale national policy initiatives. I've played a key role in the Council of Australian Government considerations around national policy agendas in Australia and elsewhere in the world. Some of the cool things I've worked on at the smaller end include piloting new algorithms running off the back of electronic medical records to help predict things like patient deterioration. At the higher end, I've helped to reorganise digital and strategy functions in large healthcare organisations to help them make the most of what technology can do. I have led significant reform initiatives in government, done corporate back-end redesign and efficiency initiatives, a lot of process redesign work. But for me, it's always been a motivation to work in spaces where I'm making a difference to society, or, in healthcare, making a difference through the provision of healthcare, the provision of wellness ultimately. And in other sectors I've worked in, it's been about a social purpose too. So whether that's social care or justice, providing and supporting community safety, always with a technology bent, but I'm a old school public sector administrator who just happens to not be a suit and tie wearing public servant in the traditional mould. Early on in my career, I spent a lot of time working in politics. So I was a chief of staff to Tasmania's first female premier while she was deputy premier and health minister. We led national health reform in Tasmania. So for me, that was, as a very young executive, a massive piece of work. We had to go from essentially health services being run as an offshoot or an arm of a ministry to sort of establish them much more in the NHS mould, where they're statutorily independent, they have independent boards, and then to work out how the back-end support services for those new independent health entities would be structured, and how to do that against the backdrop of a significant national health reform agenda, which was changing everything from the funding of healthcare all the way through to the interface with primary care in Australia, which is different from the UK environment, where you have a separation in responsibilities between the national government in the primary care space and states and territories, which had traditionally looked after the acute care sector. That was a massive piece of work over 18 months to take a very rigid, old school bureaucratic model of health service delivery and try to bring to it new thinking, extensive engagement both with the community, with patients, with carers, with health staff, with unions, and somehow try to navigate all of that change without hacking anyone off enough to cause disruption or protest or political issues, which was really quite a challenging exercise. Another great example was de-regionalising corporate structures for the Department of Justice and Community Safety in Australia, in Victoria. I had to look at reducing, as awful as it is, headcount, increasing efficiency, improving service delivery, but at the same time trying to do that in a way that allowed staff to help solve problems that they knew had existed for a long period of time, and they had a lot of interesting ideas about how to solve them, but they'd not had the leadership or the support to be able to unpack that and think differently about how they would organise business models and approaches. So we spun out there a separate infrastructure arm, for example, which became the Community Safety Building Authority. We then focused on consolidating corporate functions around new business models, and we moved technology to the centre of that to enable us to do more with less, and also to improve the work experience of the hardworking team members who were embedded in a department of 16,000, 17,000 people, trying to do their best every day, but perhaps not necessarily having the most tech-enabled environment to make that easy. Really rewarding piece of work, a lot of engagement, a lot of collaboration. Another career highlight was I won the State Service Scholarship when I was a little bit younger than I am now, to go to the Australian New Zealand School of Government. So I did my Masters of Public Administration there, which was a great privilege, and I studied in Melbourne, Sydney, Canberra, Victoria University in Wellington, and we did a lot of work with Harvard and others. So being able to kind of get a grounding in public value through being directly taught by people like Professor Mark Moore was enormously valuable to me, and I think really framed my thinking about the role of public value as the centrepiece of public policy, rather than public service being the centrepiece of public policy. And by that, what I mean is public value is independent of the sector that produces it, and a smart contemporary public servant will understand that and know how to harness other actors other than the public service itself to help deliver outcomes for society. So for me, that was quite a framing, transformative moment in my career, and I think has guided a lot of what I've done afterwards. So even though now I'm in the private sector, obviously we own our own business, those principles still sit at the core of what we do. We're still very much about delivering public value. We're very much about the outcome, and very much about how we align other actors to help produce that outcome and get people really clear on the purpose of what it is that we're trying to do. And that includes citizens ultimately, regardless of governments representing them. People have a say, and when they don't, they generally will kick up or complain. So it's much better to have them in the tent and have them helping to shape the way that services, buildings, facilities, whatever it might be, are designed and delivered.